Love the show. Thank God for radio. I don't know where we'd be without it.
I listen to you daily. Your station is so informative.
News Talk 1480 WHBC. The following program is sponsored by the Medicine Center Pharmacies.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. We're glad you joined us this morning. Before we begin, I'd like to thank our sponsors, Mercy Medical Center, Studio Arts and Glass, and of course, our socially distant technical producer, J.D. DeAngelis. We continue our shows from our administrative offices and wish our friends at WHBC and our listening audience continued good health. Our guest today is Cheryl Koniski, Executive Director of Alzheimer's Association, Greater East Ohio Area Chapter. Cheryl, welcome to the show. Thanks for joining us, and we're looking forward to talking to you today.
Thank you.
A world without Alzheimer's and all other dementia. That is the vision of the Alzheimer's Association, which was formed in 1980. It is the leading voluntary health organization in Alzheimer's care, support, and research. This morning, Cheryl is going to explain to us the differences between Alzheimer's and other forms of dementia. We're going to talk about available resources and ongoing research and support available for patients and caregivers. We'd like to remind our listeners that you can download our shows on our podcast. And later today, you can watch for this program on Facebook. We'll have the video posted and you can enjoy it live in person.
So Cheryl, welcome again to the show. And tell us a little bit about yourself and your background.
Sure. Well, good morning, everyone. I'm really happy to be with you today. As was stated, I'm the Executive Director of the Greater East Ohio Chapter, which is the chapter just south of the Cleveland area. Our metro areas are Akron, Canton, Youngstown, and we cover 17 counties within that area. So quite a bit of geography. I've been with the Alzheimer's Association for 21 years now, and really have spent my entire career working in support of individuals with Alzheimer's and other forms of dementia. I started early out as a social worker, working in long-term care and other care settings, and have been fortunate to have a nice long career with the Alzheimer's Association. It's a great organization that does very important work, and I'm proud to be part of that.
So tell the listeners what Alzheimer's is.
Sure.
I've heard it pronounced a lot of different ways. Alzheimer's. What is the correct pronunciation?
I think it's most typically called Alzheimer's, but depending on where you are in the country, I do hear variations as well. So Alzheimer's is a fatal brain disease, and it's a degeneration of brain cells in certain areas of the brain. Starts out at the hippocampus part initially, which is where we have our short-term memory controlled. And so oftentimes some of the first symptoms we see is the short-term memory that most people associate with the disease. But Alzheimer's is the most common form of dementia. There's actually quite a number of causes of dementia. And over time, it causes changes in a person's ability to think, process information, take care of themselves, and ultimately, it unfortunately does lead to death.
So we talk about Alzheimer's, we talk about dementia. Differences?
Sure. So dementia is a term that refers to a large category of symptoms. The symptoms of the memory changing, the cognitive thinking patterns, the difficulty with processing information. So it's an umbrella term that refers more to the symptoms, and Alzheimer's is the most common form of dementia. It accounts for somewhere between 60 and 80% of all dementias. Many other illnesses cause dementia. For example, stroke or vascular causes can have a dementia component, multiple sclerosis, Parkinson's disease. So dementia can be present secondary to many other kinds of illnesses.
So do we have statistics on how many people have Alzheimer's?
So currently there's about an estimated 5.8 million Americans living with Alzheimer's disease in this country today. And most of that, most of the people who are impacted are in the 65 and older range. And many people think about Alzheimer's as a disease for older individuals. However, there are currently about 200,000 individuals in this country who have younger onset Alzheimer's, which means they have been diagnosed in their 40s, 50s, any age under 65, which surprises a lot of people because I think most people don't realize that younger people also can have Alzheimer's disease.
So what do the numbers look like in Ohio, and in particular, we live in northeastern Ohio?
In Ohio, we estimate that there's about 220,000 people who have Alzheimer's. And in the service area, just as an example that I shared with you for my chapter with the 17 counties, we have an estimated 60,000 individuals. When we talk about the numbers of people affected by AIDS, we also talk about the impact on caregivers. I know we'll speak a little bit about that later, but we estimate that there's between 2 and 3 caregivers supporting each person who has Alzheimer's disease because their care needs are so intense. And that means that there's an additional 250,000 people in Ohio that are have a role of caregiver for someone with this disease. So it's a large impact in Ohio and across the country.
Why is the risk higher for African Americans?
So we know that African Americans are twice as likely to suffer from Alzheimer's disease, and researchers are really looking right now into some of the reasons behind that. That there are factors to socioeconomic, lifestyle, health differences, choices such as diet, exercise may also play a part. We also know that African Americans are more prone to the risk factors of Alzheimer's disease, such as high blood pressure, diabetes, high cholesterol. The other concerning thing is that African Americans are often less likely to get a diagnosis. And when they do, it tends to be later on in the disease process where they're more cognitively impaired and physically impaired by the time they get the diagnosis. So definitely concerning differences.
Early diagnosis, you can.
I'm sorry?
Early diagnosis, you can control it better, or what are you saying, I guess?
So the earlier that someone's diagnosed, the more proactively we can be with style and intervention changes. Planning for the future is a big reason to understand what you're dealing with sooner rather than later. Making sure that you have financial affairs in order, and that you have time to do what you want to do before maybe the disease starts to dictate more things in your life. The other thing that research is starting to show more and more is that for individuals who have been diagnosed, if they can change their diet, increase exercise, increase the amount of social activity and cognitive activity, these are things that research is showing may even be able to slow the disease. So knowing what you're dealing with sooner rather than later, you can perhaps take advantage of some of those changes.
So I guess what I was looking for was, is there any treatment to slow this disorder?
Currently, there are a few medications available that help the symptoms. So medications that many people are familiar with, like Aricept, Exelon, Namenda, those medications help to address and reduce the symptoms. So taking those medications may help someone reduce their short-term memory a little bit, improve their speech patterns, but it's not addressing the underlying cause of the disease, which is the effect of the brain cells that are being impacted by Alzheimer's. So there's some exciting new medication that's just been sent to the FDA that would be the first medication to actually treat the underlying cause of Alzheimer's. But right now, there's not a lot of options.
Okay.
Is it true that most people are cared for by their family and friends?
It is true. A surprising 83% of Alzheimer's care is delivered at home through primary caregivers such as a spouse or a child. I think a lot of people feel that, maybe the bulk of individuals are cared for in care facilities, but in fact, it is mostly delivered at home.
Okay. I hear that caring for someone with Alzheimer's or dementia is exceptionally demanding.
It is. And that's one of the roles of the Alzheimer's Association. Our programs and services really are designed to support the caregivers and help them find community resources and just be able to talk and find solutions to the challenges that they're facing. Caregiving for this disease can often go on for many, many years. The average lifespan of someone who's been diagnosed with Alzheimer's can be 8 to 12 years, but it's not uncommon for it to go much longer than that. So our work with caregivers is to coach them for the marathon, because it's definitely not a sprint, and helping them to find other resources so that they don't burn out themselves.
Well, I think it's time for our first break. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I are talking to Cheryl Konitsky, Executive Director of the Northeast Ohio Alzheimer's Association.
Okay, Cheryl, I understand you're having a community event on this Tuesday, July 21st. Where will you be talking about the impact of Alzheimer's in the workplace?
We are having a virtual community kickoff at noon, as you said, to really open it up to businesses in the Northeast Ohio area who would like to learn more about Alzheimer's and how they can get their staff involved around Walk to End Alzheimer's. During that program, we're going to talk about Alzheimer's disease impact on the workplace, which is really related to the fact it's talked about where caregiving is, most of it is happening from individual caregivers and happening at home. So a large number of people are trying to giving responsibilities and work responsibilities. And as a business, we have lots of programs and services that can be available to those employees that would support them through this. So we just want to get that message out and get folks connected to the walk if they feel that would be a good fit for their company.
How do we put this walk together now if we can't get it together? What are we going to do?
That's what we've been working on for the last couple months, and like the rest of the world, pivoting to a socially distant, safe platform And we're really excited about what we can. Normally we get together in large groups at a walk location, perhaps a ball field or the zoo, or just large group settings. And obviously we can't do this year. So what we are doing is putting together a walk everywhere concept where individuals who want to get involved and to support the cause can form a team or walk as an individual right with their own families or in their neighborhoods. And this keeps things safe and socially distant, but also very connected to the cause and the mission. We have an enhanced application that would be available to download on your phone that will live stream the opening ceremony and our Promise Garden ceremony. There'll be a walk route on the app that can track your steps as you walk. There'll be information about our programs and services, about our sponsors. So really just trying to make it user-friendly so that more people can participate in the creative platform. And then the other really neat thing about what we're doing this year is we're planting Promise Gardens in our walk community locations. So we have colored pinwheels part of our walk, and each color represents a different relationship with the disease. Caregivers carry a purple flower, individuals living with the disease carry a blue flower, and so on. So this year, we're taking all of those pinwheel flowers and planting them in a community location to raise awareness and really honor the spirit of the walk. So we're really excited about that.
These are pretty trying times with the virus. I can't even imagine what some of these folks are going through, particularly since we're all isolated and can't really go to places like we used to be able to go. So what free services does the Alzheimer's Association provide?
And you're exactly right. Alzheimer's disease is a very isolated in normal times, and now with the social distancing and the fears of COVID, it has taken a really difficult disease to manage and has made it even more challenging. Our free services and events like the Walk to End Alzheimer's make those services possible for free. Are a lifeline often for caregivers, and so we have a 24/7 helpline. We do education programs. We have support groups. We have a very informative website with all kinds of virtual connections. We do care consultation, which is an opportunity for one of our staff to work one-on-one with a caregiver or a family action plan about taking care of their loved one and making sure they do it successfully.
Okay.
All right. Tell us about your hotline and the services it offers.
Sure. 24/7 helpline is often the first point of contact for caregivers, and it's available around the clock every day of the year, staffed by very high-skilled individuals with a lot of experience working with dementia and Alzheimer's disease. And this could be a first point of contact for general questions someone might have, concerns about themselves or a family member, where to go to get a diagnosis, tips and strategies needed to help with caregiving. Any question that somebody could have can get addressed through the helpline, and then that's the opportunity for folks to really learn much more about the other services. It's also available in 170 different languages.
Oh, wow.
So that doesn't need to be a barrier either.
Do you have the phone number to list that we can share with our listeners?
Absolutely. Our toll-free helpline number is 800-272-3900.
Okay. What about, all right, well, I hear music, so it looks like we're ready for the news, and we'll hit your educational programs on the other side.
I don't hear any music. Bottom of the hour, time for the news. You're listening to Health Matters with the Medicine Center.
listening to your host, Paul White.
Welcome back to the show, folks. Today we're talking with Cheryl Konetsky from the Alzheimer's Association, discussing dementia and what else?
Well, we were going to talk about some educational programs. So how about you share with us the educational programs that the Alzheimer's Association's put together and how our listeners can take advantage of those?
Happy to. So this has been one of our challenges with COVID. We've had to shift our formats. Most of our community programs would typically happen out in public areas, libraries, recreation centers, partnering with different organizations to do programs in person. So obviously, since March, we've had to transition our education programs to be online and through webinar format, which is really even more accessible for folks and very convenient. So they can tune into these from the comfort of their own home, which is typically very convenient for caregivers. And we have topics that include understanding Alzheimer's and dementia, so you learn more about what's going on in the brain with this kind of disease, how to communicate more effectively with someone who has short-term memory loss, which can be quite a challenge, helping to understand challenging behaviors, which can come up with Alzheimer's disease, like wandering or sundowning, agitation, anxiety, those kinds of things. And then financial planning, which is so important as someone is diagnosed with this disease, to make sure that the proper planning is done ahead of time, so that ensures the individual is well cared for as the disease progresses. The programs are listed on our website, which is alz.org/East Ohio.
So are they programs that now, given this transition during COVID times, are you able to access those real time, or do you have live webinars, or do you have both?
They are live from our chapter, and that's a really great format because you can ask questions of the speaker, you can hear questions and answers from other folks, so it's much more interactive and I think beneficial. But there are recorded programs that you can access through our website, alz.org, that you can watch anytime and get the same amount of
I have to ask this question while it's still in my head, okay? You've been there 21 years, okay? How much progress have you seen in particular? Are we making any headway with this disorder?
Great question. Yes, I think back to when I started with the organization in the late 90s, and we have come so far. There's certain aspects that we're still challenged, and that has to do with treatment and ultimately a cure. But back, 20 years ago, very little funding was allocated by the government for Alzheimer's research. That has been one key area the Alzheimer's Association has really been able to move the needle with. The funding now is, so much more, over $2 billion that is being allocated each year. And that's the critical piece, because prior to the funding being available, it was hard to get researchers involved in working on Alzheimer's research. And without the focus on it, nothing was happening. So even though it's been progress, there's been really significant changes, especially in the last 5-6 years, that have really sped things up. And I think we're in for some major breakthroughs in the next couple of years.
As I recall, and I've been around for a while as a pharmacist, we had virtually nothing in the med line, medications. Prior to 20 years or even maybe closer. they thought or that did produce some results. Is that accurate?
That is true. A couple medications that have been available for 10, 12 years already, maybe even longer, have really just been symptom addressing, and they don't even work for everyone. So Aricept is a great example of that, and often can be some people find help with that, but it's not treating the underlying disease of Alzheimer's, and so it only works for usually a short amount of time if somebody's going to see some benefit from it.
So you just said something like we're going to get some breakthroughs here soon, or is that
Correct.
New medications?
So Biogen has been in the news recently for their medication called aducanumab, which is a mouthful, but it just went to the FDA, which was our big news last week. And this is the first medication that FDA is seeing for disease-modifying drug ever. So fingers are really crossed that this could be a game changer.
Would you tell the listeners again how many Alzheimer's cases there are in America?
5.8 million.
Mm-hmm.
That is a lot
How
of
are
people.
It is a lot of people. Even the 60,000 number that you mentioned in Northeast Ohio is a humbling number. Can you talk with us about how your support groups are navigating this COVID-19 world? Because it seems to me that those are probably very important in supporting a lot of caregivers and patients and helping them navigate the challenges of this condition.
Yes. So like our education programs, we had to find it to allow for support to happen in our socially distant situation right now. So we've worked with our support group facilitators, and we've transitioned all the groups to be telephone based. And some of our groups are even starting now to offer Zoom based calls, or conference call type, where you can actually see the individual. So that's been helpful to change into that format, because caregivers getting together to support each other is one of the most powerful ways that they can be helped. It's information sharing, it's tips and tricks that they've learned along the way that they can pass along to each other, and just a kind, caring, listening ear when someone needs to vent and express sadness, frustration, or even happiness. I mean, we talk about the challenges that go along with this, but there's still a lot of happy times, and life goes on, and a lot of ways to still enjoy the most important things of life. And that's really what we focus on too, is just to keep living and living successfully through this disease for as long as possible. And all of that gets talked about through support groups.
You mentioned earlier that stress is often on caregivers. How is the pandemic affecting caregivers?
Yeah, so it's been, I would say, even more isolating, and that's been the real problem. The calls for folks who are calling us for help, their situations have gotten more complicated, more difficult. Getting help from family and friends have diminished because of quarantining and concerns about transmitting the disease, COVID. So it's made things a lot more complicated and stressful for the caregiver. So we're happy to be helping individuals through to find alternatives for support, and really reminding them that they need to be creative to find ways to take a break, take care of themselves, and reach out to individuals in a different way.
Dealing with someone with Alzheimer's, I've listened to people talk and tell me about the symptoms are all across the board, from being lethargic to just literally being explosive. Is that accurate? And there's no common
Indeed.
symptoms.
Correct. We say if you've seen one individual with Alzheimer's, you've seen one individual, because the disease impacts everyone differently. It could, like you said, cause lethargy in someone or aggression in someone else, agitation, anxiety. And then some people don't have any of those kinds of negative symptoms, but, are just pleasantly comfortable and just kind of go along with what's happening. And so it's really varied. And that's another too, is there isn't an exact playbook of what's going to happen and when it's going to happen and how to prepare for it. So it's a very individualized approach, and the Alzheimer's Association can work with families to figure out how to create a plan that completely fits what's going on with their loved one.
I think we're close to a break here. So you're listening to Health Matters with the Medicine Center Pharmacy.
Medicine Center Pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
This morning we're talking with Sheriff Koniski from the Alzheimer's Association, and she's going to talk about the walk upcoming now.
Yeah, so our Walk to End Alzheimer's is happening everywhere this year, right wherever you are, and we'd love for you to participate and get involved. If you have been touched by Alzheimer's or really care about the cause, you're a perfect individual to help us raise money to help find a cure, better treatments, and support the care and services that we've been talking about today that are available free of charge. The best way to do that is to get registered at our website, which is alz.org/walk. You can find a walk that fits your schedule, but essentially this year you're going to be able to walk wherever you are on whatever day you want. So we've made it really convenient, and information there will walk you exactly through how to do it and all of the features that we will have available, and just hope that we can get even more participation this year.
What about the nursing home scenario here? Okay, we already know that the vast majority of homes, nursing facilities, do not allow visitors. Okay, and so here we have folks that are in these special divisions of the nursing homes. They can't have any visitors. One of the people that we work with, I noticed, has set up an outside visitors area, and being with the weather we've had, haven't had much rain, with tables and chairs so far apart. I thought that was very neat. I just don't know how many places have the ability to do such a thing like that. But this would, I would think the Alzheimer's folks could utilize these facilities too.
Right. And this coming Monday, July 20th, actually, is the first day that nursing homes will be permitted to begin outdoor visitation. Those outdoor visitations have been going on in assisted livings up until now for the last month or so, maybe a little bit longer, but nursing homes are going to start being able to do that as of this coming Monday. So it is really important, and hopefully families can take advantage of seeing their loved one that they've been missing for months. What we're hearing from facilities is that, without that family connection that they have gotten, that, someone with Alzheimer's doesn't understand COVID. They don't understand what's going on and why their family isn't visiting them anymore. And the staff in the facilities are doing the best they can to explain and to reassure and to get families on a screen through video conferencing, but it's hard for someone who has Alzheimer's to understand what this is all about. So hopefully families can take advantage of getting back and having some outdoor visitation starting on Monday.
Well, in a sense, the hot weather is a real benefit here because we're not having like a rainy summer or
Right.
something like that, and the people can congregate in some level of not being next to each other in a building or whatever. So
Right.
that part's kind of neat, I guess. It's so
Yeah.
hot. So I've been in an Alzheimer's facility before. I'm sure you've been in many of them, or treatment area. And I thought it was amazing that the way the one I was in was designed. I entered the facility and I couldn't figure out how to get out. Now, I don't know, the doors are walls, okay, basically, in many of these facilities. And I just looked around and I'm, how do I get in here? Because, they kind of walked me around and showed me the crafts and things like that. Then we essentially came back to where the entrance was and thought, there's no door here. So is that a common design in many of these facilities?
It's becoming more common, and that has to do with trying to reduce the urge to wander, which is a very typical kind of symptom with Alzheimer's disease. About 60% of individuals with Alzheimer's are at risk for wandering. And there's just something that gets triggered for that person to want to go out that door and be looking for something, searching for something, maybe it's comfort or reassurance. We're really not quite sure what's behind it. But to be able to camouflage the door safely in a facility, it can reduce that. And so we are seeing that design element more and more in care facilities.
Are there specialized support groups for Alzheimer's individuals?
There are, yeah.
What do we expect to accomplish with them?
So when we have a need or a large enough group of folks who have a specialized request, we try to meet that need. So currently, we have a group just for men because male caregivers have different set of challenges that they face, especially if they're taking care of a female family member. So this is a great resource for them in particular. We also have a specialty group for frontotemporal dementia, which is a particular type of dementia that has a little bit more unique symptoms. So that group just tends to be family members dealing with that. And over time, we've had different categories. So we try to meet the current need with making those available.
Are there doctors that specialize in Alzheimer's? Only can't be very many of them.
Well, geriatricians, neurologists, we really look to physicians who do a significant number of assessments because that's really key to getting a diagnosis. It's not a simple test to figure out if somebody has Alzheimer's, so it's really doing a number of tests, but then also ruling out what other things it could be. So it takes more time than usual, and really folks who can do a geriatric assessment program or a geriatrician or neurologist that specializes in this tend to have a good experience.
Good, right.
Well, we talked a little bit about research, and we're getting close on time, so I think it might be an idea if you give the information one more time about your walk, where to register, and that information as we get ready to close here.
Great. Yep. So we'd love to have you participate and walk with us this year. Walk Everywhere. You can register on our website at alz.org/walk. You can the location that's closest to it. It will be very user-friendly, and you can safely from your own home, your family, your neighborhood. Hope you can join us.
Do you have any printed signs we can put in our stores or anything like that?
Absolutely. We can definitely get those for you.
That'd be great.
That would be
We're
great.
out of time, Brad. We about done? Minute left?
Yeah, we're about out of time. It's been great, Cheryl. Thanks for visiting.
Yeah, very good. Very interesting.
Thank
So,
you for having me.
Thank you, Thank you, Cheryl Koninsky, Executive Director of the Alzheimer's Association Greater East Ohio Chapter. We would like to remind our listeners, if you suspect you have a medical issue, please contact our healthcare providers. Thank you to our sponsors, Mercy Medical Center, Studio Arts and Glass, and of course, our technical producer, JD DeAngelis. As always, we thank you listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you again right here next Friday on News Talk 1480 WHBC.
Okay.
Thank you for joining us for
Very
this
much,
edition
Cheryl.
of Health Matters with the Medicine
Thank you.
Center Pharmacy.